Welcome to AHA TV. I'm Melissa Matani and I'm delighted to be joined by Dr. Svati Shah for a recap of this morning. So Dr. Svati, it's great to have you with me. You know, this morning as I was coming in here, everybody was really pumped about the semaglutide or semaglutide, however you say it, session this morning. What was it like? Tell me about it.
I have to say it was really incredible. It's called the SELECT trial. They randomized 17,000 individuals, which is pretty incredible just in and of itself to have a clinical trial that big. And it was the first trial to assess whether we improve hard outcomes. And when we cardiologists talk about hard outcomes, we don't mean just weight loss. We mean, does it save people's lives? Does it prevent heart attacks? So this was the first trial looking at whether this class of medications called GLP-1 receptor agonists can prevent hard outcomes in individuals who don't have diabetes, but already have heart disease, a sort of secondary prevention trial.
Okay.
And remarkably, semaglutide decreased the risk of the composite endpoint by 20%.
Wow.
So really incredible results.
I mean, so what surprised you about this session? What did you learn that you weren't expecting?
That's a great question. Well, we know that these medications cause weight loss. They're used probably excessively for weight loss in America. Everybody's on it. Everybody wants it. But what was really interesting is that the curves, so when we do these curves to show like here's the placebo group, here's the medication group, and we look at survival or the event, the curves separated very early in the trial, within the first couple of months. So that's not just a weight loss effect. Something else is going on. There are indirect effects besides just the weight loss that are making people survive longer and have fewer events in the semaglutide group. Really interesting.
I mean, it's so interesting, but at the same time, like everyone's billing this as a blockbuster drug, you know, and we've heard about the weight loss and we're seeing results happen very quickly. But surely there are like other things that we need to take into account. Like it just can't be medicine solves everything.
That's such an important a point that you're making. There were two great discussants about the SELECT trial that actually talked about this. It can't just be about medicines. It has to be, you know, we can improve outcomes with the medicine, but it has to be in conjunction with background medicine. So these patients were all on background therapy, but also lifestyle, exercise, those things are really important. Treating cardiovascular risk factors when they exist. And Tiffany Powell-Wiley from the National Institutes of Health gave a wonderful discussant talk about the fact that not everybody has access to these medicines.
Right.
And even if you are on these medicines and you want to have a healthy lifestyle or healthy diet, not everybody has equal access to that. So thinking about the shared environment and how policy needs to change and affect it so that all communities can have access to healthy lifestyle and diet. And if you don't mind me telling you, the American Heart Association has a Food is Medicine initiative.
Okay.
And it's this whole concept that food is medicine. We should be prescribing healthy food. And by prescribing healthy food and understanding how to give access to that food, that we can improve access to healthy lifestyles for people who currently don't have access to it.
I mean, that's such a good point too, because as much as we're talking about this one drug, I mean, you need to think about the longevity of that. And at some point, if you're not taking care of yourself and other things, drugs aren't always going to work for you.
It's not going to overcome that. That's exactly right, Melissa.
No. So what else what else stood out to you this morning? What other sessions?
So there was another important clinical trial. It was called the Orbita 2 trial. This was a trial of angioplasty in patients who had stable angina. So patients who are having chest pain, but they're not sick enough to be in the hospital. And what was really interesting about this trial is they did the angioplasty, that was the intervention arm, and then they did a sham procedure. Okay. So the placebo arm underwent a procedure but didn't have an angioplasty. And they actually asked all of these participants to stop their angina medications for 2 weeks prior to the procedure. And they showed that patients who got the angioplasty had improvement, almost a twofold improvement in their angina symptoms with the angioplasty. Now you might say, well, didn't we already know that? But in fact, we didn't actually know that with a sham controlled trial, that the angioplasty itself is sufficient for preventing, for improving angina. So Orbita 2 was a really important trial that was presented this morning too.
That's fascinating. I mean, the day started off with such a bang. I mean, how is this afternoon going to follow?
Oh my gosh, still so much wonderful stuff going on at session. So this afternoon, another important session that really takes that same paradigm, which you nicely pointed out about diet, medications, lifestyle, and all those things integrated together, this time talking about hypertension. And then there's another session that is focused on left ventricular assist devices, which are artificial hearts, and also in children who have cardiac transplantation. So some interesting clinical trials in those spaces.
Wow, that sounds really interesting. Well, come back and tell me later on this afternoon what it was like for you.
Thanks so much, Melissa.